We're fortunate in the Frimley ICS to have an extremely mature connected care platform and a population health management tool. We know that with the COVID pandemic, there has been an immense backlog and our patients are not optimized in terms of their health with long-term conditions. We also know that primary care is under a lot of pressure with the day-to-day work with urgent on-the-day issues from patients. We know that they are catching up on other services such as screening, immunizations, and are also helping out with COVID vaccinations. Put all this together, and if there is a way in which we can reduce the pressure on primary care and yet provide a service that benefits the patients, the families, and primary care, it seems to be best provided by remote monitoring and remote management.
We've used 3 different technology platforms. We've used a GraphNet technology to produce the insight list of patients who would need intervention through remote management. We have inculcated that into the connected care platform where we have developed a virtual hub of diabetes patients whom we can discuss and interact with the multidisciplinary team to do the necessary interventions. The third technology we're using is the Docebo remote monitoring platform where the patients who have been recruited from the Insights platform are being monitored using the Docebo software where patients can input their data.
So once a patient has been identified by their surgery for remote monitoring, we will then contact the patient, consent them and explain the process to them. The patients are requested to submit data readings on a daily basis and a weekly basis. The patients will automatically get a question set and a text message come up on their tablet to ask them to submit the data. If any of the data is outside normal parameters that are set for the patient, an alert will be highlighted to our team. Our team will contact the patient and discuss the readings and determine what course of action needs to be taken, whether that is an emergency call for a 999 ambulance, or whether it needs face-to-face assessment, or just a change in medication, and that can then be forwarded on to the named lead at the GP practice.
So this has helped our GPs and clinical pharmacists to remotely manage more number of patients in a shorter span of time and do the early interventions to reduce hospital admissions and also reduce micro and macrovascular complications.